Have you noticed small but concerning changes in someone you love over the past year? Don't miss these crucial signals. When time becomes more precious than ever, many people believe that death and old age come suddenly, without warning. But the truth is, our bodies, incredibly sophisticated machines, often send out gentle warning signals months, even a year, before life reaches its final stage. The greatest tragedy? Most of us miss these signs, not because we don't care, but because they appear so subtly at first. It's only when families realize the clues were there all along. But by then, it's often too late. Too late to prepare. Too late to make special memories. Too late to say what needs to be said. Understanding not only brings strength, it brings the opportunity to love more deeply in those final moments together. Today, I'm going to share 5 important warning signs that often appear about a year before an elderly person passes away. Some of these may be changes you've noticed, but dismissed as just normal signs of aging. Others may seem minor, but actually signal the body's gradual decline. These signs aren't meant to scare you. They're meant to help you see what might be happening, so you can make every remaining moment count. Recognizing these signs early will help you provide better care, cherish meaningful moments, ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with me until the end, because understanding these signs can help you prepare both your heart and your home for what's ahead. When you know what's happening, you won't be caught off guard. You'll be able to treasure every moment with those you love. Let's begin. Sign number 1, significant weight loss. One of the earliest and most noticeable signs that a person may be entering their final year of life is unintentional weight loss. Research published in the Journal of Palliative Medicine indicates that over 50% of end-of-life patients experience significant weight loss in their last year. At first, you might barely notice it. Their belt needs an extra notch. Their clothes hang a little looser. They leave food on their plate more often. Many families overlook this, considering it just part of getting older. But the harsh truth is, sudden weight loss is rarely normal, even in old age. Why does this happen? The scientific truth behind this phenomenon is that the body is no longer absorbing nutrients efficiently. Muscle mass decreases, and essential systems are slowing down. Dr. Elizabeth Kralik, a geriatric specialist at Johns Hopkins University, explains, the natural aging process leads to some muscle loss, but when it happens too quickly, it's a sign that something deeper is going on. The body may be struggling to digest food properly, or the person may no longer be able to process protein effectively, leading to muscle wasting. This loss of strength not only makes movement more difficult, but also increases the risk of falls, weakens the immune system, makes the person more susceptible to infections, changes in appetite. Another reason for weight loss in the final year of life is a change in hunger sensations. Many elderly individuals simply no longer feel as hungry as they used to. Their sense of taste may dull. Food doesn't taste as good as it once did, and they might start skipping meals or eating much smaller portions. This isn't just a matter of preference. It's a physiological change. The body, sensing it's beginning to shut down, no longer signals the brain to seek food as regularly as before. The result, less energy, less strength, and a gradual decline in overall health. A 2023 study from the American Journal of Clinical Nutrition found that unintentional weight loss of over 5% of body weight in 6 months was associated with significantly higher mortality rates in the following year among older adults. The role of underlying medical conditions. Weight loss is a common symptom of chronic diseases such as cancer, heart failure, kidney disease. All of these conditions can begin to progress before more obvious symptoms appear. Even conditions like depression or cognitive decline can lead to reduced food intake, creating a downward spiral where the body doesn't get enough fuel to sustain itself. Some families try to address the issue by encouraging their loved one to eat more, offering favorite foods, or supplementing meals with protein drinks. But if weight continues to drop despite these efforts, it's crucial to recognize that the problem isn't just diet. It's the body preparing for a more profound transition. At this stage, forcing large meals may not be helpful. Instead, focusing on comfort, easy-to-eat foods. Sometimes a few spoonfuls of something they truly enjoy matters more than a full plate they can't finish. And hydration can make a bigger difference in maintaining quality of life. Sign number 2, extreme fatigue and weakness. Have you ever been so tired that even after sleeping all night, you still feel exhausted? That's how many elderly people feel in their final year. Except for them, the tiredness never goes away. This isn't your everyday. I'm a little sleepy feeling. This is the kind of tiredness that makes simple things feel impossible. Getting dressed becomes a major task. Walking to the bathroom feels like climbing a mountain. Even talking takes too much energy. One of the most noticeable changes in the year leading up to the end of life is a profound, persistent fatigue that doesn't improve with rest. This isn't just feeling a bit tired after a long day. It's a deep exhaustion that makes even simple tasks feel overwhelming. I still remember the story of Mrs. Grace, an 83-year-old woman whose family shared her experience with me. My mother used to be the earliest riser in the house, her daughter said. Suddenly, getting out of bed became a daily struggle. Walking across the room required immense effort, and activities she once performed routinely, like cooking, dressing, even conversing, started to feel like too much. Behind the fatigue. According to research published in the Journal of Palliative Medicine, this profound fatigue affects over 80% of patients nearing the end of life, making it one of the most common and earliest warning signs. Why does this happen? Your body is like a car running low on gas. When someone is in their final year, their heart doesn't pump blood as strongly, so less oxygen reaches their muscles. Their energy factories, called mitochondria, don't work as well, so cells can't make enough power. Their body starts saving energy for only the most important things, like breathing and thinking. You might notice your loved one needing longer naps, sleeping more at night, or suddenly running out of steam in the middle of doing something. The hardest part? Watching someone who was once independent now struggle with simple tasks. They might feel frustrated or embarrassed. They might stop trying to do things or avoid being around people because they're just too tired. This isn't just a result of aging. It's a sign that the body is conserving its remaining energy as organ functions begin to slow down. The body starts prioritizing what's most essential. According to the National Institutes of Health, as we approach the end of life, the heart doesn't pump as efficiently. Circulation weakens. Muscles don't receive the same amount of oxygen. This is why many elderly individuals in their final months feel weak, unsteady, and unable to maintain the same level of activity they once enjoyed. The slowing of metabolism. Another critical factor is the slowing of metabolism. The body is designed to produce and use energy, but as it prepares for the final stage, that energy is redirected. Instead of fueling movement, the body shifts to conservation. Research from the Journal of Cachexia, Sarcopenia, and Muscle has found that these physiological changes often begin 12 to 18 months before death, with more pronounced manifestations in the last 6 months. This is why a person in decline may start sleeping more, needing more naps during the day, having more difficulty staying awake for long periods. Some may even experience sudden energy crashes, where they seem fine one moment, but are completely exhausted the next. The emotional impact of fatigue. They may withdraw from conversations, avoid social interactions, stop engaging in hobbies. It's not because they don't care, but simply because they no longer have the energy. This can lead to a cycle of isolation, where they stop trying altogether, only accelerating the decline. For families, witnessing a loved one go from active and engaged to exhausted and withdrawn can be very painful. It's easy to assume they're just being lazy or need to push through it. But the reality is that forcing activity won't help. The most important thing is to understand their limits, allow them to rest when needed, and make their remaining days as comfortable as possible. If you're still watching this video and finding these insights helpful, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you hit that subscribe button and turn on the bell so you don't miss any videos. Your support helps us keep creating content that matters to you. Now let's move forward. Number 3. Sign number 3. Cognitive confusion or withdrawal. As someone moves closer to life's end, one of the most noticeable changes can be seen in how they think, communicate, and interact with others. You might notice that someone who was once sharp and engaged starts to forget things more often, have trouble following conversations, seem disoriented in familiar places. A grandmother who never forgot a birthday might suddenly mix up names or dates. A father who loved telling stories might now sit quietly, seeming lost in his own world. A friend who never missed your weekly calls might seem confused when you mention plans you discussed just yesterday. These changes often start small. A forgotten word here, a moment of confusion there. But over time, they become more noticeable and happen more often. Research from the National Institute on Aging shows that these cognitive changes aren't just random. They're connected to physical changes happening in the brain. As blood flow weakens and oxygen levels decrease, brain cells can't work as efficiently. These subtle cognitive changes can occur months or even a year before death. This isn't just everyday forgetfulness. The brain, like any other organ, needs a steady flow of oxygen and nutrients to function properly. They might repeat themselves, forget names, or lose track of time, even if they never had memory problems before. They might ask what day it is several times, or wonder why they're at the doctor's office when you just explained it. Stories that jump around or trail off into silence. Less interest in activities or people they once enjoyed. Someone who was always patient might become easily irritated, or someone who worried about everything might suddenly seem unusually calm. Research from neurology shows that individuals in their final year of life often have significantly lower brain oxygen levels compared to their healthier peers of the same age. As circulation weakens and the oxygen supply to the brain decreases, cognitive function begins to decline. The person may become easily confused, have difficulty making decisions, struggle to recognize people and places they've known for years. In some cases, they may even have brief moments of clarity, followed by sudden bouts of confusion, almost as if their mind is fading in and out. Another common sign is emotional withdrawal. People nearing the end of life often lose interest in social interactions. You might notice them talking less, engaging less, or spending long periods simply sitting quietly. It's not that they no longer care about their loved ones, but rather that their brain is no longer processing emotions and engagement in the same way. Conversations become tiring, noisy environments feel overwhelming, and eventually, many elderly individuals retreat into their own world. According to Dr. Ira Byock, author of Dying Well, this withdrawal is not a rejection, but part of the natural process as the body and mind prepare for the final transition. You might also notice changes in mood and behavior. Some people become more irritable, anxious, or easily frustrated. Others may seem unusually calm, detached, or indifferent to things that once mattered to them. These aren't just personality shifts, but often the result of the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may stop reacting to situations in the way they once did. For family members, this stage can be particularly difficult. Watching a loved one lose touch with reality or withdraw emotionally can feel like losing them before they're actually gone. But here's something important to remember. Even when words become difficult and memories fade, feelings remain. Your loved one might not remember exactly who you are, but they can still feel the comfort of your presence, the warmth in your voice, and the love in your touch. Instead of correcting mistakes or quizzing them about what they remember, simply meet them where they are. Speak gently. Hold their hand. Play music they've always loved. Understand that even if they don't respond, they can still feel your presence. These simple acts of connection speak to the heart, even when the mind is confused. Sign number 4, frequent infections and slow healing. As the body begins to weaken, one of the clearest physical signs is a compromised immune system. You might notice that a person who rarely got sick before now seems to catch every cold, flu, and minor infection going around. Illnesses that were once mild now take much longer to recover from, and simple wounds like a small cut or bruise heal at a noticeably slower pace. Dr. Sean Morrison, director of the National Palliative Care Research Center, notes that recurring infections often signal immune system decline, which commonly accelerates in the final year of life. You might notice that your loved one. These changes aren't random. They're signs that the body can no longer protect and repair itself as it once did. According to a study from the Journal of Palliative Medicine, approximately 63% of end-of-life patients experience at least one serious infection in their last 6 months. One of the biggest concerns is recurring infections. Conditions like get sick more often, colds, urinary tract infections, UTIs, or pneumonia seem to come one after another. Takes longer to recover. What used to clear up in a week now lingers for a month, develops wounds that won't heal. Small cuts or pressure sores stay open or keep coming back. Bruises easily. Even gentle bumps leave dark marks that spread and last. Even oral infections become more common as the immune system weakens. Many families assume these are just isolated illnesses, but when they start happening frequently or take a long time to clear up, it's often a sign that the body is losing its ability to fight back. Dr. Michael Rabo from UCSF's Palliative Care Program explains, as the body nears the end of life, its immune response diminishes. Infections that a healthier person might fight off in a few days can become prolonged issues for a declining body. Even antibiotics, which once worked quickly, may seem less effective. The person might need stronger medications, longer recovery times, multiple rounds of treatment for infections that were previously mild. This happens because as circulation slows and organ function declines, the body simply doesn't respond to treatment as well as it used to. An often overlooked issue is chronic wounds. If you notice that minor scrapes, sores, or bruises aren't healing properly or keep recurring, it can mean that circulation has been compromised. Poor blood flow means oxygen and nutrients aren't reaching the skin and tissues effectively, making the healing process much slower than normal. Pressure sores, especially for those who are less mobile, become a serious risk and can lead to dangerous infections if not managed carefully. What's even more concerning is that infections in the final year of life often don't present in the way we expect. Instead of a high fever, an elderly person might simply seem more tired than usual, be more confused, be less interested in eating. In fact, for older adults, a sudden decline in mental alertness is often the first warning sign of an infection, even before other symptoms appear. For families witnessing a loved one go through repeated infections, it can be frustrating and heartbreaking. It's easy to push for aggressive treatments, hoping that one more round of antibiotics or another hospital stay will fix the problem. But at some point, the focus often shifts from cure to comfort. A 2023 study in the Journal of Pain and Symptom Management found that in patients at the end of life, interventions focused on comfort often improved quality of life more than aggressive, life-prolonging treatments. Ensuring they are well hydrated, keeping their skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another round of medication that only prolongs suffering. If you're still with me and finding value in this information, please comment number 4 below. And remember to subscribe and turn on notifications so you never miss important content like this. Sign number 5. Major changes in breathing or circulation. One of the clearest signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You might notice that your loved one's breathing becoming different. Sometimes they may pause between breaths, or their breathing may become irregular, speeding up and then slowing down unexpectedly. Some people experience a gentle, rhythmic breathing pattern called Cheyne-Stokes breathing, where breaths alternate between deep, rapid inhales and long pauses. These changes can start subtly, but over time, they become more pronounced and frequent. According to a study by the New England Journal of Medicine, changes in breathing patterns occur in over 70% of patients in the end-of-life phase, often appearing months before death. Diminishing circulation. Another common sign is weak circulation. You might notice that their hands, feet, or even their nose and ears begin to feel cold to the touch. Even when the room is warm, the skin may look pale, slightly bluish, or mottled, especially around the fingers and toes. This happens because the body is prioritizing blood flow to vital organs, reducing circulation to the extremities. It's a clear sign that the heart is no longer pumping as strongly as it used to. Dr. Sarah Thompson, a palliative care physician, explains, changes in circulation are a natural part of the body preparing for death. It's not painful, but it can be alarming for families unfamiliar with it. Increased shortness of breath. Some people also experience more shortness of breath, even with minimal activity that once seemed simple, like sitting up, changing positions, or speaking a full sentence. Now leave them feeling winded or gasping for air. You might notice them breathing more through their mouth, needing to pause for breath while talking, struggling with activities that were previously easy. In some cases, fluid buildup in the lungs can make breathing more difficult. This can cause a persistent cough, a gurgling sound, a feeling of tightness in the chest. Many people assume this is just congestion from a cold, but in an elderly person near the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to breathe more easily. Coping with these changes. For family members, seeing these changes can be frightening. It's natural to want to help, to encourage them to breathe more deeply, or to worry that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. It may not always be possible to reverse these changes, but there are ways to make them more comfortable. Keep the room cool and well ventilated. Use a small fan to create gentle air movement or use a humidifier. Offer small sips of water. Raise their head slightly with pillows. Apply lip balm to prevent dryness. Simply sit with them, holding their hand and speaking softly. In some cases, medication or oxygen therapy may provide relief, but the focus shifts to comfort rather than trying to fix the problem. If you notice these signs, changes in breathing, cold hands and feet, or a bluish tinge to the skin, pay attention. These are often indicators that the body is conserving energy and circulation is slowing. This is a time to be present, offer reassurance, and create a peaceful environment where they feel safe and comfortable. In these final months or weeks, the most important thing you can offer them is not medical intervention, but comfort, dignity, and the knowledge that they are not alone. Final thoughts. Embracing the truth to make every moment count. As we come to the end of this article, let's take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, major changes in breathing and circulation. These 5 signs often appear in the year leading up to an elderly person's passing. They may not all happen at once, and they may not always be obvious at first. But when you start to notice them, it's a sign that the body is preparing for its final transition. For many families, these changes can be difficult to accept. It's natural to want to fight against them, to encourage your loved one to eat more, move more, or push through the exhaustion. But sometimes the best thing we can do is listen to what their body is telling us. Dr. Atul Gawande, author of Being Mortal, writes, "The ultimate goal is not a good death, but a good life to the very end." Dr. Ira Byock, palliative care physician and author of The 4 Things That Matter Most, explains that recognizing these transitions allows families to shift from crisis-based reactions to meaningful preparation and presence. Understanding these signs isn't about giving up hope. It's about changing what you hope for. Instead of focusing on trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Make each remaining day comfortable and peaceful. Share important stories and memories. Express love and gratitude. Create gentle moments of joy. Ensure they never feel alone. When my own grandmother was showing these signs, our family didn't recognize them until it was too late. We kept pushing her to eat more, exercise more, try harder, not understanding that her body was telling us it was time to simply be with her, not push her. Don't make the same mistake we did. If you're seeing these signs in someone you love, take a deep breath and listen to what their body is telling you. This isn't the time for fighting against nature. It's time for acceptance, for presence, and for love. Understanding these signs isn't about fearing death. It's about preparing for it. When you recognize these changes early, you can provide better care, make important decisions ahead of time, ensure that your loved one's final months are filled with love and dignity. This is a time to cherish moments, share stories, and let them know they are valued and not alone. The poet Mary Oliver wrote, "Tell me, what is it you plan to do with your one wild and precious life?" I would extend that question. Tell me, what do you plan to do with the precious time you have left with the one you love? If you're noticing these signs in someone close to you, take a deep breath and remember that you are not alone on this journey. Many families have walked this path before, and while it's never easy, knowing what to expect can help you find strength, patience, and peace. As grief expert David Kessler said, "For some, death is their greatest fear. For others, it is their greatest source of strength." Allow these signs to guide you in making the most of the precious time you have left. Understanding is power, and when used with love, it can transform a person's final days from a time of fear into a time of meaning and connection. Thank you for staying with me through this important conversation. Please leave a comment below and share one thing you learned today and how you plan to use it in your life. I'd love to hear from you. Your thoughts are important to us, so please don't hesitate to share them. And reading your comments gives us the motivation to keep creating content that helps families during difficult times. If you found this video helpful, please hit like, subscribe, and share it with someone who might need this information. Your support helps us continue to create quality content, reach more families when they need guidance most. Thanks for watching, and we look forward to seeing you in the next video.